Hi, I'm Vanessa Hill. We're here at the Southeastern Spine Institute in Mount Pleasant, South Carolina. This medical institute is a complete spine center with all of the latest technologies and treatments for people suffering with back and neck problems.
Because there's no other pain like that back pain. I mean, the stuff I've been through, and that back pain just knocks you down.
One of my discs started to degenerate, and I started to have a lot of pain.
Literally couldn't sit up and have a conversation. I mean, I'd come home, I'd lay down.
Now, during the next half hour, we're going to tour this wonderful facility. We're going to visit with actual patients, hear their stories, and talk with their physicians. You're going to find out that there are people just like you, people who thought that they needed and had to live in pain, but they're enjoying life now thanks to the Southeastern Spine Institute.
Always one step ahead, the Southeastern Spine Institute presents The Age of Spinal Medicine, the patient's perspective. Once again, your host, Vanessa Hill.
We'll start our tour of the Southeastern Spine Institute to examine how they utilize the latest in medical advancements and how the doctors bring in new technologies to help patients get out of pain when they were told that nothing else could be done.
There's no other doctor I had ever gone to ever mentioned this.
I was still in pain, so he gave me these options.
We start where the road used to end, and now there's avenues out there that we can take to help patients, and that's what we're all about.
The Southeastern Spine Institute has been a leader in the latest technologies. In fact, they've been a part of many FDA studies, including the revolutionary disc replacement and new hope for stenosis patients, the X-Stop. We caught up with Southeastern Spine's medical director and spine surgeon, Dr. Don Johnson, and asked him about these clinical trials and why his facility was picked over so many others around the country.
These companies are actually coming to us and picking us because they know that we're a large spine-only practice. We have a number of patients with just about any type of spinal disease that they want to investigate. And also they know that we've done many studies, FDA and otherwise, over the years, and so because of that, we're very good at getting clinical and research data together for them.
I'm in charge of enrolling the patients in our numerous clinical trials. We conduct several studies with a lot of success, and in one case would be the X-Stop. It's very helpful for spinal stenosis.
Don, tell me about the X-Stop. I know it helped Ashley Bush. How did it work?
Mr. Bush had a very difficult problem. He's a farmer, he loves his farm.
Cotton's been a pretty good crop for us over the years.
He's a very active gentleman.
I've done hard work. I mean, I've worked hard.
And when he came to see me, he said that he would do things around the farm, but then he would be essentially laid up for 3 to 5 days.
I was getting up on the bulldozer and running the bulldozer, but I was having a good deal of pain, especially afterwards.
We wanted to try to help him go back to these types of physical activities. So the X-Stop device was perfect for him. We left the muscle and bone intact. By unpinching his spinal cord, he got good relief of his leg symptoms, and he's back to doing the things he loves to do.
I think I'm doing great, and I'm probably doing things that I hadn't done in 3 or 4 years.
And so now we have a device that's approved by the FDA, approved by Medicare. That's an outpatient, minimally invasive, 20-minute surgery. It's really a revolutionary procedure.
I think I'll do a little bulldozing here. You know, bulldozing is a little bit hard on your back, but since I've had my X-Stop, it really doesn't hurt me. I can ride that bulldozer all day long, and it's jarring and beating and throwing me from side to side, and I don't have any pain.
Did you know that there is a spine condition more common in children than in adults? But while some children develop scoliosis during a growth spurt, this very painful ailment can also affect adults later in life. We met with spine surgeon Dr. Stephen Paletti and asked, what is scoliosis?
Scoliosis is a curvature of the spine. Most people know that their spines are straight. People that have seen people with scoliosis often see them bent to one side, one shoulder significantly higher than the other. Some people think that they have a hump in their back.
Verla Swaggart looks happy now, but not long ago she was almost totally debilitated and unable to do her job as an administrator for the city of Casey. The curvature of her spine from scoliosis was almost unbelievable.
Most people's spines are straight, 0 degrees. Hers was bent 60 degrees, so it was bent almost directly to the side.
I can't describe the type of pain it was. It was constant. I had, at the end, I just had to stay asleep. That's the only way I could survive.
Verla had been to many of the major spine treatment centers around the country, and the type of surgery, which is traditional surgery for scoliosis, is very extensive.
This surgery would be 9 to 11 hours. Blood transfusions, in the hospital for a couple of weeks, and, of course, intensive care.
We were dissatisfied with the results of traditional surgery for scoliosis.
Southeastern Spine wanted to do more for scoliosis patients, and in Verla's case, they were able to utilize the latest technologies and techniques to help get the best possible results.
We see patients who have been through everything out there that they think is possible, and we come up with something new that's out there.
There's no other doctor I had ever gone to ever mentioned this. And when he told me that he would not have to cut me down the back, oh, Lord, I said, well, how are you going to get in there?
This is the curvature that she had of her spine, and you can see how the vertebrae shift or translate one on the other. They don't line up. What we were able to do with somebody like Verla, who has a very complicated spinal problem, is to be able to make a relatively small incision in her side to take the discs out and to correct the spinal curvature. You can see how dramatic the curvature is here, and you can see her post-operative x-ray here. The nice thing about her surgery is that instead of having 2 operations to go through her chest and make a long incision in her back, her surgery was done through 10 incisions this long. Don and I have worked on this type of system. This percutaneous system is a system that we developed probably about 3 years ago, and it allows you to be able to put these rods in your spine without having to make a long incision. You can make little incisions, so the less you cut, the less trauma you have, the less blood loss, the less
the easier recovery.
Recovery, less pain. In a case like hers, she was able to go home from the hospital 48 hours after surgery with no blood loss.
Oh, my coworkers, they can't believe it. I mean, nobody can believe that a person can be changed like that.
Wonderful. She's my height now. She's probably about 2 inches taller.
It was like a different person. She grew up on us, too.
And I walk back and forth the breezeway. And they all get a kick out of that, because before I was humped over, but now I'm just as straight as I can be.
We've just seen 2 success stories of people freed from debilitating pain thanks to the latest medical technologies. But when it's your back pain, you may be like many other people and concerned about the actual treatment. Well, when we come back, the tour of the Southeastern Spine Institute continues. We're going to follow in the life of a typical patient who is trying to find relief for his agonizing pain.
Back's been hurting for a number of months, and as toughness comes along, I thought I could get on through it and work through it, and my toughness is not nearly as what I thought it was.
The Age of Spinal Medicine, the patient's perspective. Presented by the Southeastern Spine Institute will continue. For more information on spine health, please visit us on the web at southeasternspine.com or call toll-free 866-SPINE-50. Once again, your host, Vanessa Hill.
We followed one patient suffering from back pain during his entire visit to Southeastern Spine. To see what really happens at the Institute, here's Lyde's story. Remaining very active in his semi-retirement, Lyde Huggins had been suffering with back and lower leg pain for quite some time. Finally, Lyde complained to his family physician in his hometown of Myrtle Beach. The doctor knew the fine reputation of Southeastern Spine and recommended Lyde make the trip to Charleston.
Myrtle Beach is...
More and more people out there realizing that their back is bothering them. There are more minimally invasive things that you can do these days to get help with your back pain. So we were able to get him in to see Dr. Paletti.
Are you having pain down your legs?
On the back side, but here, right here, it goes across right there on whatever that ligament is.
Right.
Dr. Paletti thought that he needed to have an MRI done. So MRI was able to get him in.
Doing okay? All right. Not during the loud knocking noise. That would mess us up.
Dr. Paletti thought that basically his back was worn out.
Now your back pain is coming from your back, and your hip pain and your leg pain is coming from your back, and you do have just about every disc in your back kind of worn out.
From all the athletics, the sports, the coaching, the being on his feet, the playing golf, whatever it is that he used to do.
You know, I would try to do an injection. I think it's a reasonable thing to try. It's an alternative to doing a much bigger operation, which we wouldn't consider no matter what. Our biggest advantage is that if we see somebody and they need to have an MRI, they can do it now. If you need to have an injection, you can do it now. If you need to see another specialist to treat your problem, you can see it today. One of the advantages that we have by having all of these services and all of these physicians under one roof is that it changes the landscape for people. You don't have to go to one doctor's office and then to another scanner and then to another doctor's office. It can all be here and it can all be treated efficiently.
We talked with Dr. Ricky Richardson, the physician who was going to perform the simple epidural injection. The goal was to quiet the inflammation that was causing the pain in Lyde's back.
And so now I'm able to look at his films that were just done and to see where the best spot is going to be for him to have this injection.
No, just relax your arm for me.
After a short wait and some preliminary preparations such as getting his blood pressure checked, Lyde walks into the block suite to meet the doctor.
Hello there. Dr. Richardson, I'm doing well. It's good to see you. All right. I was just looking over your MRI scans there, your pictures, and I understand you saw Dr. Paletti earlier today. And
it's not surgery. It's much quicker. The procedure usually takes 10 minutes or less. The patient's in the recovery area for 10 to 15 minutes. They take it easy for the rest of that day, then are able to begin to get back to their normal activities the following day.
Oh, yes, sir. I want to talk you through this whole procedure. There won't be any surprises here for you. I'll let you know everything we're going to do. We got your pictures coming up on the screen right now. You're going to feel this cold metal rod here on your back. I'm just going to use this to mark our spot here.
Down a little more if you look at
That's great. That's good. We're going to make a little mark. Actually, where you feel the pain sometimes is not exactly where we do this injection.
The main active ingredient is a steroid. We're not using the same steroids that you see the athletes using. These are corticosteroids, the intention of which is calming down inflammation and swelling.
Super. And we are right where we need to be here. We're going to inject some of this medicine now. You might feel this in your back, down your legs, or not at all. Feel some more pressure here.
All of the above.
Is that right? That's a good sign. It means we're getting that medicine right where you need it here, okay?
All done.
And that's it. We're finished. And the injection went very well. Our goal here is to have patients come in, and the quicker we can see the patient and actually have a good working diagnosis and to determine what is causing the pain symptoms, and the earlier we can get going with treatment, the better. And so we're very fortunate here in that oftentimes we can get the MRI scan and the injections all done at the same day.
The good part is that making the patients feel better, coming in knowing that they're in a lot of pain, and when they leave that they're not in a lot of pain. And they feel better. We've accomplished what they came in for.
We spoke with Lyde after the procedure to see how he was feeling and what was next.
Dr. Paletti suggested that the injections might be a good way to go and thought he could help the pain that I'm having, and it certainly has already done good, and also gave me some physical therapy ideas that they wanted me to try.
work on sitting up nice and tall, work on extension activities. The Southeastern Spine Institute, it's an all-inclusive facility, and sometimes if a patient comes in and they're having a lot of pain, the physicians will actually refer the patient over to us that day so we can do physical therapy and kind of calm down their acute symptoms and get them on their way. The purpose of physical therapy is to return the patient to their normal quality of life. We work with them doing mobility exercises, and that might be hands-on techniques, doing joint mobilizations. We may do just active stretching exercises with them or passive stretching exercises.
Okay. Can you pull up into my hand right here real gently? Good, and hold it. 1, 2, 3.
We also do a lot of lumbar stabilization and pick out appropriate exercises for the patient.
So we were able to get him in today, and he's on his way home to Myrtle Beach. So it all worked out that he could get it all done in one day. But we try to do this for a lot of patients. We have patients that come from all over. If a patient's going to drive to see us any kind of distance, we try to make sure that if they're here and we can accommodate them, seeing the doctor, getting a scan if they need it, or even a procedure, we certainly try to get that done for them all in one day.
After his injection, Lyde hasn't had any trouble with his back in over 2 months. We caught up with him here at the Southeastern Spine Institute as he came back to update Dr. Paletti to say that he is back to normal.
How's your golf game?
I'm still shooting just about what I needed to shoot, one better than my opponent.
That's more than I can say for myself.
Lyde wanted to show off his golf game, but the rain forced us inside. Well, that didn't stop Lyde from taking a few pain-free practice swings. So we asked him, do you have any restrictions?
Well, let me turn up.
So are you saying that when this happens, you can still do it, no restriction?
None at all.
Okay, let's see what you have. You know what, Lyde, it looks like you're doing this without pain. What do you think?
Well, I'm being able to take a full turn. The guys I've been playing with, they're going to be surprised if I win a match or two.
It's nice to see people getting back to doing the things that they love. When we return, we're going to take a look at patients who were once treated, but they're doing so well they don't need additional treatment.
I love him. I love Dr. Paletti. I haven't seen him in 9 years, but that's a good thing.
The Age of Spinal Medicine, the patient's perspective. Presented by the Southeastern Spine Institute will continue. For more information on spine health, please visit us on the web at southeasternspine.com or call toll-free 866-SPINE-50. Once again, your host, Vanessa Hill.
Today, Kelly Forsberg is able to lead an active life, but 9 years ago, her back pain kept her away from the things she loved and made it difficult for her to raise her 2 young children. We asked her today if she remembers how difficult her life was back then.
Well, something as simple as going to the grocery store wasn't an easy thing to do. I mean, literally trying to walk through the grocery store, lean to one side to keep your back from hurting, buy groceries, go to the checkout. I mean, I think I remember one time literally leaving my groceries there because I couldn't stand the pain anymore.
Kelly tried almost everything: rest, medication, physical therapy, even a series of shots in hopes of solving her problem. But in the end, a simple surgery turned out to be the best solution.
Nobody wants to have surgery, but if it's something that's going to make it, make you better, make you feel better. I mean, your back's your whole body. And I literally felt better the next day.
Many people think that if you have one back operation, you're going to end up having back operation after back operation. But for most people, that's not the case. For example, someone like Kelly, who had back surgery 9 years ago, is still doing well now. And that's the case for the vast majority of people.
Things that I couldn't do, vacuuming, I mean, anything, gardening, I couldn't do it. I can do it now. 9 years, knock on wood.
You remember our story on Ann Burbacall a couple of years ago. She's the dancer whose leg pain almost jeopardized her career. Ann Burbacall leads an active life as a dance instructor, so it's important that she is always at her best.
I had actually been having back pain for about 2 months.
and I never pursued it. I just kind of figured it was part of the nature of the business. You know, I'm no spring chicken anymore.
But when back pain got so bad she couldn't give her students 100%, Ann turned to the Southeastern Spine Institute.
Clear, concise diagnosis, clear, concise direction to send me in for treatment.
Following her doctor's course of action, Ann recovered and quickly returned to her active job.
You should just hear me hooping and hollering in the classroom. The parents out in the lobby are like, oh, it's so good to hear you back 100%. You sound like you really feel great. And I'm like, I do.
Well, it's been 3 years since Ann's life-changing surgery. We caught up with her just outside of her studio. She is still teaching and still going strong. It has been 3 years. You look fabulous. How's it going?
Everything is fantastic. I am just feeling so strong and so back to my old normal self. I'm teaching these dancers every day of the week, 5 days a week, 4 to 5 hours a day. Life is great. I feel terrific. You know, Dr. Paletti said, just give it time. I have every faith that you'll be back to 100%. And I am.
And you're moving every day.
I am, absolutely.
You glad you did this?
Oh my gosh. 3 years ago, I was teaching this class sitting in a chair. So, yes. It was,
wow, times have changed.
Oh yeah, absolutely, without a doubt. It was the best decision I've ever made.
There are many such success stories of women who are able to fully get back to their active lives thanks to the medical professionals here at the Southeastern Spine Institute.
I started to have a lot of pain even as early as high school. And after I had my second daughter, it was excruciating. I used to run, and it became a big challenge for me to exercise. It was a pain that I just lived with every day.
Celeste is now pain-free and doing all of the things a young person wants to do. She has some advice for people her age who might be a little apprehensive about seeking treatment for their back problems.
I think they all have the stigma that back surgery or back treatment is not going to help. It's going to, cause more problems. That's what they've heard from their grandparents, from their parents, and that's not the way it is anymore.
During our tour, we also spoke with some of the other doctors, physicians' assistants, and staff members just to get a sense about the professionalism and the dedication for all of the good work that takes place right here at the Southeastern Spine Institute.
Since I started this practice in 1991, my goal has always been to provide a group of the best, most highly trained, specialized physicians providing spinal medicine that we can.
When the patient comes in, they're not just seeing a doctor, they're seeing a whole team. We all confer with each other, and we have therapists, physician's assistants, and doctors, and so we're going to get the best result for each patient.
Always good to see you.
Always good to see you.
Take care of yourself. I'm glad we helped you a little bit, all right?
Yes, sir.
Oh, absolutely. Particularly new patients. I think it's important to really get to know them. Pain in particular can be influenced by a number of different issues. So we like to know more about the patient's medical history outside of just spine-related disorders too. All of it's part of just doing a thorough job.
The more a patient gets to talk with people that understand their problems, the better they're going to feel about their treatment plan. So it's always encouraging to have a PA around.
We're able to address the patient's concerns in a team approach, a one-to-one physician-PA team, and the patient gets good quality care.
We get letters that say, these doctors at Southeastern Spine have changed my life. Not only have they changed their lives, some have said they've given them a life back. That's pretty strong.
When we come back, we're going to talk to a very active former police officer and world-class powerlifter who found that back pain can really bring your life to a standstill.
There's no other pain like that back pain. I mean, the stuff I've been through, and that back pain just knocks you down.
The Age of Spinal Medicine, the patient's perspective. Presented by the Southeastern Spine Institute will continue. For more information on spine health, please visit us on the web at southeasternspine.com or call toll-free 866-SPINE-50. Once again, your host, Vanessa Hill.
Our final story is about a former police officer, a SWAT team member, a world-class power lifter, a guy over 50 years old who is still playing competitive ball with the younger guys. When Rodney Young began having back problems, he was glad that he found the Southeastern Spine Institute.
A lot of times you go in and you talk to a doctor and, you tell them this or that, and they say, well, I see you do weightlifting or something like that, and they ain't got a clue. But we got to talking probably about the first 10 minutes, and he goes, I got somebody on my wall I want you to see. And we walked into the hallway, and up on the wall was Doug Riccofreni, a friend of mine that I've been powerlifting with forever, and he did some work on him. So I just knew that I was talking to the right guy.
Well, we sat down with the right guy, Dr. Don Johnson. Let's talk about athletes, people like Rodney Young. How did you help him?
He had a terrible spinal problem. We knew that he would need a surgery, and really what allowed him to get back to the types of heavy weightlifting that he does involved not destroying or cutting or moving any of his muscles. His muscles are his power, and we wanted to leave those muscles alone. So he had a procedure done which is quite innovative, where we made a small incision actually through his side. Through this incision we were able to put a microscope. We removed the disc, we did a fusion. This fusion really is unbreakable. This type of procedure, maintaining his muscle, allows him not only to be strong, but also to be able to rotate his body, to twist his body, and to get back to things like hitting a baseball.
He told me that, he goes, Rodney, you're not going to break that thing in your back. You can just do whatever you need to do.
It's easy to see that Rodney is back to his active life, thanks to hard work and treatment that he received at the Southeastern Spine Institute. Recently, we caught up with him and asked him about getting back on the ball field. Are you surprised? Every time you get a chance to pick up that bag or dress out and get ready to do it, do you ever say, never thought I could do it, surprised, feel good about it?
Well, you always hear of everybody's back injuries, you did it this way, you did it that way, and you can't do this, can't do that. Well, the second it happened to me, that's what's going through my mind. And now that I've had the surgery and I'm back 100%, just knowing that I can do that and not be sitting at home and watching it on TV or watching somebody else do it, I'd rather be out here, and that's what I love to do.
And that's what you do. There have been many changes over the years in spinal medicine, and the Southeastern Spine Institute has been a leader in many of the new technologies. Well, now that there are changes to the healthcare system in America, we can look forward to more challenges for doctors and medical professionals. But once again, Southeastern Spine will remain in the lead. Thank you so much for taking the tour of Southeastern Spine with us. Please join us again for more on spinal health and you.
I think that because we have all of these spine services under one roof, I think because the doctors in the practice have been together for 20 years, you're able to find a quality of care that's equal to that anywhere in the country.
So there are new things out there. There are things that can be done with lots of patients who have been told that there are no other options.
Once patients aren't responding to regular treatment as far as just rest and over-the-counter anti-inflammatories, and then once that's not working, then unfortunately when they get to the point where they need to see us, then we're able to get things moving and do that rapidly.
Our goal has always been to take care of our patients and help our patients get back to a normal life. Certainly there's going to be some change in healthcare in this country, but our goals are never going to change.
For more information on spine health, please visit us on the web at southeasternspine.com or call toll-free 866-SPINE-50.